Welcome to the case study series in Human Resource Management by Skilled MBA. In this session, we explore DeepTek.AI, a rising player in India's health tech space. This case focuses on the company's efforts to revolutionize radiology using artificial intelligence, addressing two major challenges: the adoption of emerging technology in critical healthcare and the establishment of trust in AI-driven diagnostics. By the end of this case, learners will be able to evaluate the opportunities and risks of AI adoption in healthcare, understand radiologists' concerns around trust, usability, and workflow, develop marketing strategies for AI products in regulated, human-centered fields, assess the market dynamics of India's healthcare sector, where innovation must meet constraints. DeepTek.AI is a healthcare AI startup specializing in radiology diagnostics. Their core value lies in using machine learning to enhance diagnostic speed, accuracy, and efficiency, especially vital in India's overburdened healthcare system. By doing so, DeepTek aims to empower radiologists, not replace them. AI adoption in healthcare. Balancing efficiency with trust. Radiologist workload and efficiency. Using AI to ease burden. Trust and validation. Building clinician confidence in algorithms. Market expansion. Positioning in emerging economies where healthcare needs are urgent, but resources limited. Strengths. Advanced AI capabilities. Solutions aligned with radiologist pain points. Scalability in high-demand markets. Weaknesses. Resistance from traditionalists. Integration. Complexity. Trust gaps with end users. Opportunities. India's healthcare expansion. Rising patient volumes. Radiologist shortages. Threats. Competing platforms. Regulatory uncertainties. Institutional inertia. Political legal. Data security. Liability. AI compliance. Economic. Budget constraints. Rising tech investment. Social. Cultural acceptance of AI in medicine. Technological. Integration hurdles. Algorithm transparency. Environmental. Not a direct factor, but efficiency helps sustainability. Legal. Intellectual property, patient data, confidentiality. Understanding how radiologists adopt new tech. Innovators, 2.5%. Tech enthusiasts, early adopters, 13.5%. Opinion leaders seeking gains, early majority, 34%. Pragmatists needing proof, late majority, 34%. Skeptics requiring validation, laggards, 16%. Deeply resistant to change. DeepTek must target early adopters and guide them along the curve with focused strategies. Awareness, exposure via conferences or peer recommendations. Consideration, weighing pros against trust and workflow. Disruption trial, testing platform on select cases. Adoption, integrating into daily diagnostics. Advocacy, recommending to peers once trust is built. This journey emphasizes the need for clear value and seamless onboarding. As DeepTek.AI advances its mission to transform radiology through artificial intelligence, it must overcome a series of critical adoption barriers. These are not just technical, they are deeply human and organizational. 1. Trust issues. What are the main concerns radiologists have about the accuracy and reliability of AI-based diagnostics? This question addresses the emotional and professional risk radiologists perceive. How can these concerns be mitigated? Through robust technological validation, transparent algorithm explainability, and strategic communication initiatives that emphasize AI as an assistive tool, not a replacement. 2. Workflow integration. Can DeepTek.AI's platform seamlessly integrate into radiologists' daily routines? Here, design matters. What user interface principles should guide the experience? A good solution reduces clicks, aligns with existing software ecosystems, and supports, rather than disrupts, the diagnostic flow. This is where human-centered design meets healthcare innovation. 3. Organizational resistance. Even if the technology is strong and the doctors are convinced, what happens when institutional culture resists? Hospitals may be slow to adopt innovations due to legacy systems, unclear regulatory pathways, or simply fear of change. DeepTek.AI must work closely with hospital leadership to build trust, align incentives, and reframe innovation as enhancement, not disruption. Evidence-based validation, publish clinical studies, radiologist collaboration, co-design tools, educational programs, train for usage, not just adoption transparency. Explain AI logic in human terms. Trust isn't just earned, it's engineered. Target high-volume centers, where need is greatest, strategic partnerships with equipment providers and hospitals, tiered rollouts, urban to Tier 2-3 city expansion customization, adapt for different hospital types and patient profiles. Market growth hinges on meeting real local needs. Content marketing, webinars, case studies, ROI stories, targeted campaigns, messaging by stakeholder type, doctors, admins, policymakers, professional engagement, sponsor forums, host discussion platforms. Marketing must educate, reassure, and activate. 30% time reduction in image interpretation, 95% diagnostic accuracy confirmed by human review, 40% increase in workload capacity, 85% user satisfaction from clinicians. These numbers are critical to demonstrating the platform's real-world value. Strategy pros cons: enhance accuracy with continuous learning, improves trust, long-term impact, R&D intensive, slow gains, target early adopters, speeds entry, limited initial reach, pilot programs and incentives, builds trial base, gathers feedback, high initial cost, system integration, frictionless adoption, technically complex. All options require trade-offs between speed, cost, and scalability. Tech alone isn't enough. Trust must be earned. Healthcare AI must complement, not replace human professionals. User engagement and education drive adoption. Strategic marketing matters as much as the innovation itself. Cross-functional thinking, linking HR, tech, and strategy, is key. Thank you for exploring DeepTek.AI, transforming radiology with artificial intelligence, as part of the case study series in Human Resource Management by Skilled MBA. This case highlights how even the most advanced AI must earn human trust before achieving meaningful impact. It reminds us that the future of work, especially in healthcare, requires more than innovation. It demands empathy, evidence, and ethical strategy. Stay curious and keep bridging technology with human-centered solutions.